I would guess that if I see 50 patients with a rotator cuff problem, one or two might need an operation, maybe slightly more than that. The vast majority, depending on how far along the continuum of injury they are, can be treated without an operation. The treatment starts out conservatively. Anti-inflammatory medications could be helpful if the patient can tolerate them. There are frequently strengthening exercises that can be of some help, and many patients will get a course of physical therapy when they first come in. In some situations, we use cortisone injections. Cortisone injections can be very helpful because you can be very selective about where the cortisone goes. And in some situations, because we put cortisone and Novocaine into the area together to treat the problem, it becomes fairly obvious by the time the patient has left the office that, at least for the moment, you've diagnosed and addressed the problem, because if the Novocaine goes into the area where the problem is, that is the rotator cuff, the pain goes away. When I was an intern and when I was first starting practice, a rotator cuff injury in a laborer could be the end of their working life. It was sometimes that devastating. Part of the problem back then was that the techniques of repairing the rotator cuff that we have now hadn't been developed yet, and we had to cut through normal tissue. Part of the procedure is what we refer to as a decompression, and we use special burrs, much like a dental drill, to remove the front part of this bone called the acromion and this ligament, which is called the CA ligament. That essentially raises the ceiling so that when the rotator cuff is healing, there's more room. Also, the joint between the collarbone and the shoulder blade, which is called the AC joint, frequently has some arthritic or degenerative changes, and the burr or the drill can be used to take away part of the arthritic portion of that bone and any spurs that are underneath in this area that might be contributing to the process of what we call impingement, where again the muscle is being damaged by the overlying spurs and bone abnormalities. Then the issue becomes getting the muscle that's retracted sometimes a centimeter or two back to the anchor point. We place devices called suture anchors, which are like little absorbable or metal screws that have stitches coming out of them. And sometimes we'll place them in a little row across this part of the bone called the tuberosity. You can imagine that stitches would be coming out of those. Well, recovery from rotator cuff surgery, it's a long process, but it is fairly predictable. The patients don't go to physical therapy right away. We really let the tendon heal for a month before we start aggressive physical therapy. So the first month, even though the pain is a lot less, is inconvenient because the patient isn't allowed to do very much. Once the first month has gone by, then we do send them to physical therapy. And the initial physical therapy is primarily directed at regaining their motion. That's a traditional physical therapy teaching that you have to get motion before you get strength. Once they've got their motion back at month 2, then the therapist will start with strengthening exercises. And the difference between rotator cuff surgery and almost anything else is that the muscle that we're rehabilitating is really only the size of your little finger. So the rehabilitation can involve heavy weights or barbells. It has to be really guided and by a therapist who's experienced in that. Usually that 4th and 5th month, the patient is starting to do more functional strengthening. They're starting to use weights that are more compatible with normal life and job activities. I feel confident that 99% of patients who have a rotator cuff tear that have a repair at 4 to 6 months are going to have a shoulder that's painless and functional. When I read the post-op reviews of the patient experience at the hospital. They always comment on how caring and wonderful the nursing staff has been and what a good place it is to get care.